Hello, everyone. Assalamu alaikum, and a very good afternoon. And from whichever geography you have joined, location you are online, we are all available. So, good morning and good evening. So, we don't know from which part people are joining here. So, I have a very special mentor of our Smart Natives Yoga Studio, that is Dr. Manjunath, who is there with us. Thank you so much, Doctor. You are here sincerely. This is so much, like gratitude on behalf of all community that you are going to today speak to us about one very important topic. I'm not going to disclose the topic now, but I want to talk about you, that Dr. Manjunath, you are a consultant, reproductive medicine deputy medical director of Birla Fertility and Baby Science IVF Clinics. You have joined from India, Bangalore. So tell us more about you, then we will go to the topic. So your journey and, as a gynecologist, yes. Over to you.
Thank you so much, Dr. Nahid, to inviting me, and it's always pleasure to connect to you and to your audience. It's really, it's like I will be waiting. Okay, when can I talk to you and your audience? I'm really thankful for that. Basically a gynecologist. I did my MBBS from Davangere Medical College in Karnataka, and after that, my post graduation in Bangalore from Bangalore Medical College, which is a prestigious institution. So that institution gave me lot of courage, lot of knowledge, lot of confidence in me that I can serve to a large people in my gynecology and infertility. After that, I did my specialization in IVF, that is fertility thing, from one of the institution called Advanced Fertility Center. And after that, I went to UK, got trained there in the UK in Homerton University. And after that, from past 19 and after close to 20 years, I'm doing the gynecology work, the fertility work, and I'm seeing a lot of women and few men also. In that, when the fertility comes, we see men also. So a lot of families are in contact with me. A lot of couples are in contact with me, and I get to learn so many things from them. So their social issues, their social problem, their apart from their fertility, they discuss with me their general health issues. So that's when I got an opportunity and thought that why I should not learn about the general health and the aging process, the longevity things, because a lot of people suffer from chronic disease when they hit around 45, 50. Nowadays, even at 30, 35 years, they are diagnosed with diabetes, hypertension, so many autoimmune disorders, those kind of things. So whenever I discuss with my patients, they tell a lot about their the social things, their activities. So that's when I came to know that there are a lot of ignorance in them. There are means ignorant means they're well educated, but when it comes to this particular aspect, they are not aware of the things. So that's when I wanted to go into the depth of the longevity, the whole attitude of the health. So that kind of study which I did, and I'm wherever possible, I'm trying to share that knowledge with the people.
Yeah, thank you so much. Particularly today, we are going to talk about women, muscle, and aging. So, my first question to you is, how does muscle loss after 35 affect a woman's fertility or the
Yeah.
hormones or overall aging?
Yeah. So when it comes to the women, they are not particularly looked as people who shouldn't be having a good muscle. I'm not telling the woman should be like a muscle builder or a weightlifters, but they should have a correct proportion of muscles and the fat and all other tissues. The problem is after 25, the peak muscle will reach around 25, between 25 to 28. After that, the muscle will start losing. It's a natural phenomena to lose after 30 the muscle. We call it as sarcopenia. So sarcopenia is the term where we use where muscle is lost. How that muscle is lost? every year around 0.5% of the muscle is lost after 30 years. So roughly in a decade, means in a 10 years, around 5 to 6 percentage of your muscle is lost. So that's the thing. But if you're sedentary, even more loss will happen. Sedentary life means not doing any physical activity, just restricted yourself to your work and sitting work and your home. That's it. That's a sedentary life, right? So if your sedentary life, maybe that will become more worse. The muscle loss will become more. So it starts at 30, and it after 50, 60, it will exaggerate. Say by the time they come to around 60, 65, 50, 40 to 50% of their muscle loss means muscle mass is lost.
Correct. Mm-hmm.
So that's a very big amount of muscle loss, because you need to understand in your whole body, muscle is the only organ which can control your whole metabolic pathways. The whole
Got it.
metabolic pathways, the liver is the master, but the entire control system happens in the muscle. So liver will work on as like a master. It will send the signal, it will send the molecules, it will send the nutrients to all parts of the body, just like that. But muscle is the one which will control that entire metabolic pathway. So if
Mm-hmm.
imagine if 40-50% of the muscle mass is lost, your metabolic things also will come down drastically to such an extent, like 50%, your metabolic things will go down. So
Mm-hmm.
that will affect your all other hormones. It will affect your bones. It will affect your fertility part, especially the menopause. Once the menopause sets around 45 years, even more metabolic things will get deranged. So
Mm-hmm.
what are the things we need to do? So we will discuss that, Dr. Nahid,
Yeah,
in few
yeah.
next few questions.
Today we are discussing about women, muscle, and aging. So now, what I'm hearing in my community, we have around 640 women who are still, I see they are unaware about this. As they come to me and they send messages that they have problems of fatigue, weakness,
Correct.
so while they are regular in their diet and they are quite intelligent and learned
Correct.
about it, so what do you think about this?
See, that's what. When they are at 35, 40 years, so when they usually they do this yearly checkups, right? Once in a year or once in 2 years, they do. All parameters will be normal, but still they will have that kind of fatigue, or not like some kind of anxiety, some kind of like disinterest in other things. Those kind of things
Mm.
will usually develop after 35, 40 years, and which will exaggerate once they reach around perimenopause and the menopause. So in that case, if they do the general parameters, some of them they show the abnormality in the general blood test and all, but majority they may not show the abnormality. But already the chronic inflammation, that muscle wasting has started in them. It doesn't mean
Mm.
that your blood tests are normal means everything, the whole health is normal. No. So you need to understand that in the muscle fibers, in our muscle fibers, there are two types of fibers, type 1 and type 2 fibers.
Mm.
Type 1 is the one which is like, it will give you endurance, which will make you balance,
Mm.
which will help you in balance yourself, normal walk, those kind of regular activities which will help. That is type 1 fibers. Type 2
Mm.
is the fast twitching muscle, which will help you in doing things in a faster way, like quick actions to be taken, quick like running. Those kind of things will be helpful in type
Yeah.
muscle fibers. So these hormones, once the estrogen hormone is the one which will help in keeping the type 1 muscles strong. So
Okay.
that's why at the menopause, after 45, 50 years, once they attain the menopause, the estrogen comes down. Type 1 muscle becomes very weak and thin. That's why they lose balance. Say when they are walking at 55, 60 years, some people falls down. Those kind of things, or there is a difficulty in getting up from like chair without the support of the hand.
Mm-hmm.
This is the simplest
Yeah,
test
yeah,
also,
yeah.
they can do that. So without the help of the hand, can they get up sudden? Means suddenly. So they will not be able to get up because that kind of muscles are weak. And one
Got
more test is an hand grip test. You call
Mhm.
that. There is an instrument to test that. Otherwise, simple test is, can you open the tightly closed caps, bottle
Mhm.
caps? So that also gives you an idea whether that muscles are going waste. So these are all the
Mhm.
things, things you need to keep looking for, like whether my the muscles are getting wasted, my whether muscles are getting weak. So
Yeah.
if anything is there, you should do certain things which we will discuss in the later part of our discussion. What are the things? So
Mhm.
basically, the muscle is acted upon by various hormones. As I told, estrogen will reduce the type 1 muscles. The
Mhm.
testosterone will reduce the type 2 muscles, and
Mhm.
your corticosteroids will reduce the type 1 muscles. Thyroid
Mhm.
hormones will reduce. If it is hypothyroid, it will reduce the type 1 muscles. If it is hyperthyroid, it will reduce the type 2 muscles. So like that,
Mhm.
hormones also will affect your muscles, which will
Mhm.
overall contribute to your metabolic thing. And one more thing is, the muscle is the one which will play very important in insulin mechanism.
Mhm.
You all know what that insulin does. Insulin will be helping in glucose control, right? So once
Correct.
the muscle weakness happens or the muscle mass goes, more insulin will be required to push your glucose from the blood to the muscle. So it
Mhm.
basically what happens, the insulin will be trying to push the insulin to all your muscles, all your other organs, everything. Suppose if the
Mhm.
muscle mass is less, that insulin has to do more work and more insulin is secreted. That's why if you do the fasting insulin, the insulin will be more than 5. The
Mhm.
general reference the lab value give is around 4 to 22. That's not the value. I keep repeatedly telling, if you want to be healthy, your fasting insulin should be less than 5. It's not up to
Mhm.
22 normal, no. So if there is more insulin, that means your muscles are not working properly. Your
Mhm.
pancreas is secreting more insulin. So once it keeps secreting more insulin, then at one point of time, it will stop secreting the insulin. That's how you are completely like diabetic kind of thing, type 2 diabetic kind of.
Got it.
So all these are interconnected. Your thyroid muscles, your estrogen hormones, sorry, thyroid hormones, estrogen hormones, insulin, muscle. So muscle is an active organ where all these hormones will be acting and controlling your overall metabolic pathways.
Very interesting. So, can you just tell a little more about when I talked about fatigue and tiredness? This is a common problem women
Correct.
are coming. Another symptom which they come is, so I want to understand more, about the connection of muscle and this symptoms, menopausal symptoms like anxiety, poor sleep, and weight gain. And the weight doesn't
Correct.
reduce also. So,
Correct.
just
Yeah.
share about this
Sure.
also. Thank you.
So once after, usually the weight gain in a normal person also, weight gain will start increasing after 25, basically after 30, 35 years. So basically what happens in this, the muscle mass will start decreasing, but the fat percentage in the body keep increasing. So fats are of three types. One, you all know, visceral fat. The second one is the subcutaneous fat, means the fat below the skin, and the other fat is fat which is infiltrated into your various organs. So as the age increases, especially in the Asian population, what happens?
Mm,
The visceral fat and the fat into the other organs will start increasing. Subcutaneous fat may be normal, but
mm,
the visceral fat is the one which will increase after the age. And suppose imagine in the muscle, the fat is infiltrated. Instead of muscle fiber, is fat infiltrated. So your
mm,
muscle will not be able to function. It will not be doing its proper job. So obviously you
mm,
will feel weakness. Like
mm,
even if you walk for a half kilometer, 1 kilometer, you start getting that weaknesses in your legs, especially the joints and the thigh or the hip region. You will start really feeling that weakness. Or if you
mm,
take one floor, you will start feeling weakness. So these are all
mm,
the things that your muscles are not working. Why it is not working? One, because of the hormonal things which I told in the earlier answer, and plus the fat gets start accumulating in your muscles. So
Mm.
it will not, that particular fat won't allow that muscle, particularly the leg muscles or the thigh muscle when you are walking, will not allow
Mm.
that to work properly. So obviously you will have that kind of weaknesses. And
Mm.
also the muscle will produce certain kind of neuropeptides also. It's like you might have observed, if you do certain kind of exercises or certain kind of workouts, so that on that day you are fresh, active, that your anxiety will be less, you are very
Mm. Correct.
involving with the
Yes.
people, you see, have seen
Mm-hmm.
that. So that's
Yeah.
because when you work out, your muscle will release certain kind of brain neuron peptides,
Mm.
neuropeptides. So that will go to the brain and activate certain areas where it will reduce all kind of worries, stresses, those kind of things. That's why the people say, if you have any important meetings or important job, work out and go. That's because your mind is clear. There
Mm.
is no fogging in the mind. There is no
Right.
anxiety. So
Mm.
that's the thing, connection between muscle and the brain. So we
Mm.
all should at least 4 to 5 days in a week, we should spend on our physical activity. It may be whatever, it may be cardio, yoga, it may be weight resistance, but particularly muscle, if you talk, weight resistance is the resistance training, that is endurance training, is becomes very important. Like at
Mm.
least 45 minutes in a day,
Mm.
3 weeks in a day. It's not like continuously 3 days in a week. If you do the resistance training, your muscles will feel healthy. The fat infiltration into the muscle will come down. Your hormone systems will start working. I told you, right, this thyroid. When you do the
Mm.
thyroid hormone will be normal, but still they will feel that fatigue, all those things. That's because locally inside the muscle, the T3 and T4 ratio will change. The T3
Okay.
T4 ratio changes means the type of the fibers that I told you, type 1, type 2, that ratio will
Mm.
change. So with
Mm-hmm.
that ratio, you will not be able to, that ratio type 1 and type 2 muscle fiber ratio should be optimum. If that ratio is not optimum for your work, for your
Mm.
kind of activity, that fatigue will set in. So that's why my advice is simplest: good sleep and a good workout is the
Mm.
most important. You need not take any big supplements or anything like that to boost your things. These two
Mm.
things, if you do, that's
Mm.
50-60% of your things are taken care.
Mm. Thank you so much. This was really very relevant and it will help so
Yeah.
many people. And I want to thank the people who are watching this. And I urge them to watch this till the end, as it is only 30 minutes. But this is going to help. Even if it is not the women are not watching, and these are men who are there who are watching, this is for your sisters and your wife, friends. You can really share with them because this is to help them. So another thing which now comes up is, can low muscle mass affect the IVF success, pregnancy health, or recovery after childbirth?
Yes, definitely it will help. Both side, like the obese and the thin people, both side the IVF, they have studied multiple studies, and they have confirmed that if the BMI is, even if it's low also, you will not have a good success rate in IVF or a conception, natural conception or an IVF. And even if it's obese, more than 30 or 35 BMI also, there is a problem in conceiving, and in IVF also the success rate will be reduced. So that's why what we tell them, to have an optimum. So there was like there are like recently 1 week back only, one lady came where the BMI was 15, 16. The minimum BMI should try to conceive is at least 19 to 20. So 15, there is no problem. Means the first of all, the conception problem becomes difficult, and the childbearing towards like entire 9 months becomes problem. And after the delivery, as you told, that after the childbirth also, the recovery period, that postpartum period, what we
Yeah.
call 6 months, is very important, physically
Mm-hmm.
and mentally also. That's where
Mm-hmm.
that you will the pelvic floor muscles, your entire musculoskeletal system has to regain that strength. So that becomes a problem if they're both side, both obese and the underweight. So that you need to take care before you enter into the pregnancy. Your muscle mass, your body composition should be optimum. If it's obese, again, as I tell you, in case of obese, the fat infiltration to all the organs will be more. So try to reduce that fat percentage in the body by doing either cardio plus the muscle. See, when you are doing both cardio and the resistance training, on one side the fat composition will come down. When you are doing the resistance training, the muscle mass will increase. So automatically, if you do 5%, means 2%, 5% reduction in the fat, 5% increase in the muscle mass. So that will give you double 10% increase in the composition of your whole body. So
Yeah.
that's how you need to target. So cardiac plus resistance training. Of course, it should be properly guided with a diet and nutrition also. It's not like only exercise I will take care, I can eat
Yeah.
anything. No, you cannot do that. You should have a diet, proper exercises, proper sleep, and if required, supplements. So
Correct.
these four things, if you have in a proper composition, a proper right way, you can achieve an ideal mass before you try for a conception. During 9 months of pregnancy, the complications will be less, and
Yeah.
after the delivery also, you will recover fast. So you can enjoy that entire period of bearing and the family making.
Mm-hmm. Thank you. This is really, very, very important for people. Especially now, I see in my family, my brother's wife is on the family way. So now this is the fifth month for her. So all the
Okay.
people, because there is so much excitement. So when they
Correct.
learn and they
Correct.
understand,
Correct.
so this
Correct.
helps.
Correct.
So now the last question for this today's session, we will take this forward. The last, I have few more set of questions after in your next session. You have
Sure.
session every 15 days, so people who are
Sure.
following you can see like at this the gapping your sessions, and this I'm feeling this is the part one of women, muscle, and aging. And in the part two, we will be discussing, of course, like what to do, what not to do. So why
Correct.
so many women they lose strength after 40? As you said, the blood reports are absolutely normal. So this also, like very simply, if you can just tell us some one, two, three. So while the reports are normal, still they are feeling the strength is lost.
Yeah. So as I told, the reports will be normal, but the things will be first of all, for the reason one is all these normal reports, the reference range they give, no, that's a general public thing. They have taken a ratio, means the common ratio, and they have given, but which
Mhm.
may not be suitable. As I always give the example of this insulin, fasting insulin, the reference range they gave is between 3 to 22. It's a wide range, but nowadays the studies are showing that if you want to be healthy and taking care, it should not cross 5. It should be between 3 to 5. So if it's crossed 5, it's not that you are not diabetic, but
Mhm.
your metabolic things are also already started deranging. So such
Mhm.
kind of person, if they go and do a blood test, the general physician, everybody they say that okay, why everything is fine, normal. No. So that's when the insulin start raising, the muscles is affected, and you will have a fatigue syndrome. Not only because of the insulin, because of various other hormones. Like example, I told the cortisol, the stress hormones. So that
Mhm.
also will alter your muscles. It especially affects your type 2 muscles. So you cannot do the things which you supposed to do in a fasting manner, like getting up from the chair. It's like you have to do first, or you want to reach out to certain things, or you want to catch hold of your kid, you want to catch hold of the other person by moving quickly. Those kind of activities not happening because again because of the stress or very various things, the cortisol hormones will become more, and the cortisol will affect the muscle fibers. So like again, as I told, the thyroid will affect the muscles. So again, thyroid, when you do T3, T4, and TSH, everything looks be normal. But at locally, the muscle at the locally means at inside the muscle, the ratio will be altered. So all these things will be affecting the your fatigue things, your muscle and the thing. So, but when you do the general blood test, you will be normal. But you should check those particular thing. Like I told, if you want to test the cortisol level, you should test in the early morning between 6 to 7 the cortisol level.
Okay.
The people will test those cortisol level in the afternoon, and by that time in the afternoon already the cortisol level has come normal down, and it will be like told like it's normal. That should the proper testing and a proper reference range, that is the important thing.
Okay, okay. So now a personal question to you. Are you ready? So what is that one story you would like to share with the people who are watching you as your transformation, like some before and after you were dealing something, or
Yeah,
now
yeah.
what you created?
Yeah. See, I told you, right? I'm almost 19, 20 years. This is my. So initially, to establish any as a surgeon or a doctor or any infertility specialist, I used to run around. I was least bothered about my physical activity, my sleep. Everything was disturbed. So I used to go and operate even in the midnight, 2 o'clock, 3 o'clock, and used to travel a lot, sitting in the chair, sit and go and sit in the consultation room, sitting in the chair, sitting in the car. That's all. And no physical activity, no good sleep. This was so that started hampering my overall health. My HB1AC started became 6.2, 6.3, which is quite high. My fasting insulin started rising. My cholesterol is more. My triglyceride was more, and I had a severe gastric problem. Gastritis, what you call acidity. So
Okay.
that's called as again a leaky gut. What we call as I will explain what is the leaky gut in some other video. We can talk about that gut health only. We can talk about that. So that leaky gut, because of which all my means leaky gut means there may be a microscopic gaps in the intestinal coil where all the bacterial toxins will enter, and it will enter into your bloodstream and causes overall inflammation in the body. My all inflammatory markers were abnormal. So but from past 2 years, I took 2.5 to 3 years, I made a decision, my conscious decision, that I should take care of my health. I should not be doing all this kind of thing. So I started doing physical activities. I train myself weekly, 3 days. Strength training, that is resistant training. I do 1 or 2 days of cardios in a week. So roughly around 4 to 5 days I work out. It's not that I will work out every day. I don't want to become a muscle builder or this thing, but I want to take care of my body. So
Yeah.
I'm doing that. Plus, I started my doing the diet thing. I was earlier, it was completely carbohydrate rich foods. So now I completely cut down. Means I'm not cut down my complete carbohydrate. I maybe my portion will around 15%, 20% is carbohydrate, more of good proteins and little bit of fat. So I started taking protein supplements, not your whey protein or anything. You should. We will talk about again what kind of proteins you need to have. We will be giving you in a next lecture, and certain kind of antioxidant supplement, certain kind of supplements to have a good sleep, not the sleeping tablet. There are good supplements to have a good sleep, which we will be discussing again in some other videos. So those kind of things, I sleep soundly now 7 to 8 hours. A good protein diet with good supplements, a good exercises. All my parameters, my HB1AC now is 5. 5.2 is the target. I have achieved 5. And my
Great.
fasting insulin is 4. So my cholesterol is still, total cholesterol is still more, but SDL and LDL cholesterol ratio is normal. So like
Okay.
that, it has become really quite healthy now. And I'm satisfied. There is no mind fatigue or the physical fatigue. I can easily, without taking, means the exertion, I can climb 4 floors So it's a
Mm.
good thing.
Yeah, yeah, transformation, a living
Yeah.
transformation for all of us.
Yeah.
Mm.
That's what the same thing has to try and means whatever I have done, whatever I tell, I have experimented on
Mm.
myself. So I
Yeah,
wanted to pass on the same message
yeah.
to lot of people so that they can live healthily.
Yeah, and we are running a community of GCC women, and here the motive is to help them. Most of the women out of these 640, the numbers which we have, they deal with just five problems majorly. One is their this low energy fatigue, and one is the hormone crisis, PCOS, PCOD, and menopause, all this the hormone thing, and one is poor sleep, and the other one is stress, and the fourth one, stress and anxiety, and the fifth one is like what is it, body pain and joint pain. So
Yes.
these are the five things which is coming across. So thank you so much for being here. And next time, yes, one of the question which we will start with is how protein important protein is in strength training and movement for women in and hormone health today. So this is next time. So I'm just giving the audience interest to join the next time. And if anybody wants to ask any question, we are open to like you commenting it, and we would be definitely reaching out to you. So that, Dr. Manjuna, thank you so much, and this was such a lovely session. 30 minutes like just went by so informatively for people. So thank you once again for being here. Thank you so much.
Thank you so much, Dr.